Hi, this is Melissa.
Hey, Melissa, how's it going?
Hi, Melissa.
I'm good. How are you today?
Doing well, doing well. And I guess, Jordan, are you there yet?
I am. I'm here.
Ah, great. How's it going?
Very well. I'm in between patients as we speak.
Oh my gosh, so we'll make it quick.
Excellent timing.
Yes, it was perfect. I was planning to do this, right?
Right. So we'll be very fast for you then. So the question is, the reason that we had you here today, obviously Luno is one of the sponsors of the conference, and we're really appreciative of that. But Jordan, I got to hear, you're in the Chicagoland area, and I'm kind of curious, what's your experience been with sort of opening back up and trying to get going again?
Yeah, absolutely. Well, we kind of, I would say, we've been in a slow open as everybody since May 2nd. So we were still in the midst of our, state mandated shutdown, if you will, when we started kind of easing back into patient care. During our full shutdown, we had basically just kind of revamped to do telehealth, created new websites. I mean, basically everything that everybody had to do to be the quote unquote new normal. As of May 2nd, I came into the office and we had to change, a lot of our protocols. The main thing that we did was, spacing out our patients. Hence the reason I have time in between patients to speak on the phone right now. I would say the main things, that we have done is trying to make everything, again, as touchless as possible. We're a small, kind of private practice with multiple locations, but when I'm here and seeing patients, I'm gloved up, masked up, the room has been sandy wiped, everything is ready for the patient. And I'm basically personally meeting my patients at the door after they call the office to say, is it safe to come in? Meeting them with hand sanitizer. I'm opening the door for them so they don't have to touch anything, walking straight into the exam room, literally trying to keep them from touching as many surfaces, not only to protect myself and the other patients coming through the door, but I think just to give patients that sense of safety and security that like, hey, these people are looking out for me too. If I'm treating every patient that way, they know that the person who's here before them and the person who's after them is going to have a safe and, comfortable experience with everything.
Right. And actually, I pulled up your website just to show everyone, when you pull up your website, you get the COVID warning there and giving people advice on what to do. So very obviously, from the moment they come to your website, they're engaged and thinking about it.
Absolutely. When we have a questionnaire that's going out, I mean, we're emailing every single person before with a questionnaire, kind of the standard stock questionnaire of, risk factors and everything else. And we're trying to set our schedule. And I know I had some conversation with a couple of dentist patients of mine, like, hey, what are we doing? Why are we asking people if they're over 60 or 65, are you still going to see them? And in our practice, we absolutely are. But what we're doing is we're trying to make our schedule such that the higher risk patients are the first of the day. So, our slots, we are strategically placing, an 80-year-old diabetic with COPD. They're not going to be middle of the day after there's already been, a higher risk of, an asymptomatic person coming through the door. That person's going to get a fresh office right off the jump to keep it as safe as possible for them, and then again, working backwards from that. And I'm reaching out to these patients again personally as well, calling them if something on the questionnaire is flagged at home and saying, hey, listen, what do you deem urgent? Do you feel like you want to come in? I'm more than willing to do all these extra steps for you, but if it is something that we can do and we can push this off, another month or two, do you want to give them that opportunity and make them aware? Again, I feel it's our job as the healthcare professional to let people know, what the real risks are out there and what we're doing to try to help them.
Yep, absolutely. And, one other thing that we've been talking about a lot this morning is this idea of using technology to try to at least minimize your odds of getting infected, right? So keeping people at a distance. We actually showed a video before of people who drag their entire pretest area into the parking lot and have people drive up, which is sort of an interesting solution. What are you doing technology-wise in your office to try to sort of minimize the contact as best you can?
So for us, again, our office is such that I don't have a pretest area. I personally do everything. And we have, the VX for our Visionix with our wavefront topography, everything else right there. I have a retinal camera right here. Again, with those, the beauty of the automation, right, is I can hit the button, get it started, and step back. I'm doing everything with door open, to try to, again, keep the airflow moving through. we do have the beautiful and fantastic digital Phoropter, the VX65 as well, which has probably been the saving grace of everything, because the high contact time where you're literally ear to ear reaching over someone's mouth type of thing. I am sitting in the door 9, 10, 15 feet away, running it through a tablet, which is absolutely fantastic, from that. And it gives the patient the opportunity, again, to know that, like, hey, this person's not breathing on me. We don't have to worry about, holding our breaths or any of those kind of things from a manual Phoropter standpoint.
Right, and I just put up on the screen for people who are unfamiliar with the VX65 what it is and how it looks like. It looks just very much typically like an Android tablet, it looks like to me. So is that how it works? Is the whole UI just sort of encapsulated in the tablet?
Absolutely. So I have a Samsung tablet right here, running an Android software, and it literally, you can take it and drag it and move it where you want to. So from that standpoint, again, I don't have to be tethered to anything. I could move myself to the parking lot and do a voice conference back in if I wanted to, probably.
Wow. Yeah, it's really, really sort of neat. And then there's the control panel as well. I'm looking at that too. So is that just sort of something you dock the tablet to? Yeah,
absolutely. So, the way that the system is set up, there's two different, I guess, iterations, if you will. One that literally looks like the Phoropter that you're used to. And from that standpoint, it's an image, if you will, on the tablet screen that has the same knobs, the same dials, everything that you've always used from day one, that gives that kind of instant learning curve that you don't have to learn anything else. You don't have to twist a knob or move something. It is, you spin up, you spin down, you tap here, you move there, you twist the dials. Everything that we've always done is still there. The second mode would be, again, the little jog dial type one, which if you've used digital Phoropters of other manufacturers has kind of become a standard. I personally have been using this machine for quite some time, and I like the look of the tablet version. I'm used to it. It's comfortable. It's easy. And again, even when we've had other doctors that have come in to, kind of sub for the practice for a day, there's no learning curve, right? They just basically can do it. You show them 2 seconds and it's right there in your face, easy to use, simplistic. It's fabulous.
Right. And kind of curious, how do you get the data, in the system, not knowing sort of what the back end looks like at all this? How does that work where you're drawing data from this? How does that work in practice?
Yep. So we have, like I said, we have the wavefront topographer from Lenovo as well that will pull over the data. And from the standpoint, you can pull in refractive data. So, the autorefractive data, you can pull in lensometry data. And then you can also program a previous RX with a new RX. And it literally pipes right in. You hit one button after it's done and it zips right in. At the end of the exam, you have the opportunity to, again, you click one button, end exam. There's basically an interface box that pipes right back into your software. It throws that into the software, and you will, again, get your autorefractive data, your lensometry data, your manifest refraction data, all piped right back in the system. It's 2 buttons. It is about as easy as you could possibly hope to have from that standpoint. And again, from if you haven't had a digital Phoropter, if you've never used, a digital Phoropter, the ease of it, the simplicity of it is fabulous. The thing that I would say, even pre, COVID and what our quote unquote new normal is, and the ability to safely be away from someone in safe distances, the ability to hit one button and show a previous RX versus the new RX, that alone is worth its weight in gold.
Right.
Patients sit there, you hit one button, and it's like, hey, this is your old, this is your new, this is your old right eye, this is your new left eye, this is what it looks like at near versus distance. That instantaneous feedback for a patient, that lets them see and know, rather than, trying to flip before, all right, let's look through the Phoropter, let's put on your old glasses. Well, I can't tell much of a difference. If you can occlude an eye with one button, hit another button, and show them a difference, they get it right away. It's right in their face. Right.
Yep. And, taking a look at this tablet-based interface, it looks pretty simple. And I'm kind of curious, Melissa, obviously you're with Luno, and what other sort of products do you have that are kind of based around this sort of interface?
Sure, Adam. We have our iRefract, which is a dynamic binocular wavefront refraction. And then we also have our Nexi retinal screener, and that also operates off a tablet. So the Nexi, I'll tell you a little more about, because you guys are going to talk to some of my other coworkers about the iRefract, I believe, tomorrow.
Yep.
But the Nexi is our newest addition to the Visionix portfolio. and it's an affordable next generation fundus screening camera that combines an automated process with advanced imaging technologies. It captures a high resolution 45-degree angle view of the eye. It's easy to use, fully automated, and it's optimized for telemedicine.
Oh, cool. Yeah, I'm actually pulling it up on the screen right now so people can take a look at it as well. And is this something that you recently acquired? I'm trying to remember. I thought I saw this at a trade show a while back.
We did. Our company, Luno Technology, acquired Nexite, which is an Italian company, in October of last year. So we're just bringing the Nexi out here in the U.S. started this year. So, and some people call it the sexy Nexi. It's kind of cute, makes cute noises.
That's funny. Yeah, the industrial design is such that as people are looking at it right now, you can see it's actually kind of a cute unit, and it's rather small as well.
It is small form factor, and easy to use. I mean, it's 32 pounds, and literally you could take somebody and off the street and literally show them how to use it. I could show them how to use it, and they would be using it within 5 to 10 minutes. Very easy.
Yep, and I'm seeing that there's obviously a tablet-based interface, so you can get pretty well distance from the patient, right?
Absolutely, yeah. I mean, and you can actually be in another room and remote into the device and use it. I mean, a doctor could technically use it from their home.
We've actually heard this concept. What do they call it? Reverse telemedicine, where you keep the doctor away from the office and just use the staff to try to keep the doctor, sort of the linchpin in the office, from not getting sick.
Exactly. And all of our devices allow the doctor to do that. So
that's fantastic. Yeah, and in fact, I'd recommend everyone who's listening to us to head on into your booth today at the show, where they can get a real overview of everything that you guys are doing too. To try to sort of keep the patient and the doctor as separated as possible.
Yeah, absolutely. Come talk to us. I mean, I'm one of the clinical application specialists with Luno Technology, and we'll be there, and the salespeople will be there. We can chat with you from the booth today. We can actually set up virtual product demonstrations for you so you can see all our devices while you're comfortably at home or you're in your office. Just reach out to us.
Yeah, pretty neat stuff. And for people who aren't familiar with you guys, you can see the names of the different companies that make up your product portfolio. Obviously, like Brio has been around for a very long time. That's probably even from my father's generation. So you guys are actually made up of a bunch of different companies now, right?
We are. So our company is under Luno Technology. And then we've got the Visionix products, which are based in Israel. Then we've got Brio Waco. Waco was originally German, and now it's based in France with Brio, which is a French company. And Luno was also a French company. And we've got over 100 years under our belt with all our companies.
Right. And you guys are actually located in the Chicagoland area, is that right? You're in the Central Time Zone, that much I know.
Yes, we are. Our home office here in the U.S. is in a suburb of Chicago.
Great. Okay, cool. Well, is there anything else that you might want to let people know about today?
Just that you can find us. We have our website, Luno Technology USA. You can find us on LinkedIn, Facebook. Reach out to us. We'll be happy to, like I said, give you a virtual demonstration of our product, show you how they can work for you in this social distancing time.
Okay, well, great. So Jordan, Melissa, thanks so much for being here today. And, again, I hope everyone heads on over to your booth and speaks with the reps that are there. Because there's certainly a lot to learn, and we'll be talking about you guys. Again, we're going to have another interview tomorrow. And we're going to keep talking about the different technology, because I think what you're doing is really important. I know that there are so many docs right now who are just trying to figure out how to navigate this stuff, right? Particularly perhaps people with older equipment who might now want to use this to take the opportunity to make a change, to try to sort of revamp their workflow in an age of social distancing, which I have a feeling is going to, if it's not permanent, it's certainly going to be around for quite a while.
Exactly.
For sure. There's going to be an awareness.
Yep, absolutely. Great. All right. Well, thanks, guys, for being here today.
Thanks, Adam.
Thank you, Adam. Appreciate your time.